We get asked quite a bit about field first aid and field first aid kits and like, okay, what do you recommend? And I know from having written about this a whole bunch and dealing with some of them, there's kits out there that are pretty basic. Some simple stuff in there. And then there's these comprehensive 130 piece kits with field guides on how to use it. How do you approach that? Or how would you address the average bird dog owner going out and saying, this is what I'd really be concerned with having, and this is what I wouldn't be so concerned with?
Yeah, I think you'd have to define the word, average bird dog owner, because I feel like it's up to that individual to take a look at what's in these kits and decide for themselves whether they do you understand the purpose of any of these things that you see, or a small subset, or does everything make sense? You have like a nursing background or EMT kind of background or things like that. So there's no point in spending money on stuff that you're not going to utilize down the road. So I think you're going to get probably different opinions based on the veterinarian that you discuss this with. But I tend to recommend for the average person, which is whatever that is, basically a bare minimum kit that will allow you to clean a wound and cover a wound and then treat pain until you can get proper medical care. And so that really runs the gamut in terms of something real simple like, gauze and wrap. And then some saline flush or some betadine, iodine, the brown stuff, just to kind of clean out a wound. And then, just some basic medications that you can keep on hand that your vet would probably prescribe, without a current need, for down the road or for travel and things like that. That's pretty much what's in my kit, to be honest with you.
What are those medications?
So I keep carprofen that I already referenced with the osteoarthritis. So that's like sort of the dog equivalent of ibuprofen. A lot of people want to do something like aspirin or some sort of natural forms of aspirin because you can buy that at some of the pet stores. That's like one of those drugs that has, in my opinion, too much of a double-edged sword in terms of side effects versus efficacy. So I like ones that are really designed to really work just for pain in dogs. So I keep those around. I'll probably keep Benadryl around. I feel like for so many things you encounter in the field, that it's just a real classic one to keep those sort of immune reactions under control. And then if I was a bird dog owner going to a vet, I would say, hey, can you prescribe me some amoxicillin or something like a cephalexin? Those are both antibiotics have slightly different spectrum of coverage for deep wounds or some kind of skin rash or something like that, scratches that can help out when you're in the field. Those are pretty benign antibiotics. I don't think any vet, well, I can't say any because there's a full spectrum of us as well, but most of them would be like, absolutely. And then I'd say the last one in that drug category is probably metronidazole, which is an antidiarrheal, like a very, very powerful antidiarrheal antibiotic that really works extremely well. That's when you're traveling, you want something like that on hand.
Mm-hmm. Back up a second to the Benadryl. Is the application for dogs out in the field the same as it would be for us? I mean, a lot of people carry Benadryl if they get stung by a bee or have a reaction to something. Is it different for dogs?
No, same sort of deal. I mean, I keep it sort of like as depending on where you're at. Even in a rattlesnake bite scenario, it's certainly not going to hurt anything. But spider bite, some kind of weird reaction to some sort of bee sting that the dog's never encountered before. Whatever happens, if they're swelling up and acting really weird, that's a drug you really wish, if you didn't have it, you really wish you did.
Mm-hmm.
And it's like it's a good one because it's sort of hard to overdose. I think clients that I run into tend to underdose dogs for the most part, as they do with things like aspirin as well, which is why I like to have a labeled bottle of carprofen that tells you exactly how much to give. But for Benadryl, it's a pretty easy formula.
Which is what? Do you know it?
Like a milligram per pound.
Oh, okay.
So humans come in 25 milligrams. So you got a 50-pound dog, throw them a couple. And then that if they get, the worst that's going to happen, I think, in that dose is they get a little sleepy, but I think it'll help a lot.
When you're out west hunting big country birds a lot of times, so you're covering ground. Are you carrying a kit with you all the time, or is it in your truck?
It's in my truck, to be honest with you. Yeah, I kind of go light. I've also been, like I tell people this anytime I get asked that question, I've also been extremely lucky. So I'm probably due for a major disaster where I wish I had it on me, but I feel like I can improvise knowing that if it's that bad, I'm going to have to do something back at the clinic anyway. Like, I have my brain and my hands, but if, a good veterinarian, it's a lot about the tools and diagnostics too that we have at our disposal. So I think I just something real light if I was going to carry anything at all. I always with the exception of like a multi-tool that I can use, like the pliers for extracting some quills, porcupine quills or things that's on my person. Of course, a knife and things like that. If I need to irrigate something, I feel like I can rig up my water bottle in a pinch to push something out of an eye or an ear or something like that. But yeah, usually it's back at the truck.
Yeah. Well, I'm glad you're honest about that, because there's the tendency in those situations to say, oh, I carry this comprehensive kit with me all the time. It's kind of like when you go into the mountains elk hunting, people will ask you your gear list, and you almost always want to like embellish and say like, I carry all this safety stuff, but really it's, you weigh those decisions. And, if you've spent your life and your dog's never really been in trouble out there, it's easy to not, and kind of what maybe I'm wrong here, but I feel like you're kind of walking around saying like, if it's something that a little first aid kit like that could be, if it's an injury I could address with that, it's probably not that serious, and you can kind of MacGyver it to make it back to the truck. And if it's something where you need beyond that first aid kit, you're getting back to that truck to the emergency vet anyway.
Yeah, I feel like that's exactly the scenario I'm trying to talk about. I can't think of anything, unless you have real formal medical training, and even in the human field, I'd recommend somebody carry this so they can fix up a laceration in the field as good as new. Like, I wouldn't do that to my own dog, so.
Well, so on that note, then, one of the most common components of a first aid kit is a skin stapler. And you hear people using them all the time. Our dogs hit freaking fences and they get cut up out there. It's actually, even when you spend a lot of time out there, it's pretty rare for your dog to get a bad cut out there that you would need it for. But you hear people you got to carry that. You got to be able to staple them back together. And I'm always like, I wouldn't be that confident with one. Like if I had to use one, I'm sure I could. But I always think like, if you have that, like how many people are out there looking for an excuse to use it or are going to use it and then have that wound that didn't get cleaned out, and potentially when a professional does get a hold of that dog, goes, man, I got to sort of reverse engineer this fix job and start over in a worse place than if it hadn't been addressed at all?
Yeah, I encounter that quite a bit. So I usually have to undo all the staples that are attached to the dog when they come in to have the wound properly taken care of, because it's really hard. It's not that the staples themselves wouldn't work. It's the fact that it wasn't properly cleaned underneath to make a sterile or quasi-sterile environment so that you could cover it back up and have it heal normally.
Yeah.
That's the issue that I run into. And we scrub that skin really carefully and clean out debris and rock and stuff from underneath, in addition to starting on antibiotics. If you're missing one component of that there, you're going to end up with not a train wreck, but a wound that gets infected and probably dehisces, which means opens back up despite the staples. I think that it's human nature to like embrace there's like this power. I can't describe it. Like when you do surgery on something or when you fix a wound like that, it feels really empowering. And I think people kind of geek out on that. And that thrill has long since passed me in my medical career. Like I don't find that all that appealing anymore. But for some people that have that skin stapler and then just enough knowledge to be dangerous, I think it can be I wouldn't say it's a dangerous tool. It's just something that I don't find necessary in the field. If there's a big wide flap of something that's open and dangling, and every time it moves, the dog is in pain, if you threw a couple of staples in there just to keep it from flopping back open, then I think that's probably acceptable. Just don't try to fix it into this perfect, plastic surgery type kind of look to it. I think it's not necessary to do that. I just tend to for myself, I just tend to wrap them up. If it's on a limb, which usually is, they tend to get those big flap ones like right on their forelimb in the front, catching it on wire or whatever. Just wrap it up in something to get them out of there. Yeah,
that I feel like in my life I'm at the stage where I trust professionals a lot. Mm-hmm. Like I default to people who actually know what they're doing, and that's one of those situations where you hear some horror stories from the field of things that go really, really wrong with dogs sometimes, but a lot of times that's a situation where a dog's gonna die like there.
Yeah, sure.
like dogs jumping out and breaking out of a duck blind or a boat when somebody shoots a cripple on the water and shoots them in the back of the head or something that's just like nothing you can do. It's over. And then most of the injuries are these things that are, we're kind of a lot of times apply human emotion to them. And we look at it and go, and if I had like a comparable size flap of skin hanging off my leg, I'd be hitting SOS and like, come get me, and your
Right.
bird dog is like, obviously you can tell when they're in pain or something's bothering them, but they're probably in a lot of situations doing pretty well. And it's us interjecting that holy shit moment. Like, whoa, I would be terrified,
Yeah. And then a lot of people don't have a sense of like how much blood loss is just a reasonable amount for the type of wound and how much is excessive. So when I do emergency call or take those kind of phone calls, I feel like that's kind of what I'm trying to figure out. And for a lot of people, they're just like, there's blood everywhere. And from what they're describing, I know there's probably really not by my standards. And some people, I just try to figure that part out in terms of gauging the severity of it all. But I think the human emotion side of it is you kind of touched on it. I think pretty important to think about.